Good afternoon, everyone. Thanks for joining us for this media briefing for January 11th, 2022. I'm Melissa Morin, a Public Information Officer with the Whatcom County Health Department, and today we're joined by Dr. Sudhakar Karlapudi, Chief Medical Officer for PeaceHealth Northwest Region. We're also joined by Dr. Amy Harley, Co-Health Officer for Whatcom County, and Erika Lautenbach, Director for the Whatcom County Health Department. As we get started, just a few housekeeping reminders. We're first going to hear from each of our speakers, just a few remarks from each before we go ahead and open it up for questions. Those questions are limited to members of the media. So when we reach that point, you'll be able to type your question into the chat. And if you would please identify yourself and your media affiliation, I will call on folks in the order presented there. And then last, a reminder that this meeting is being recorded and will be made available later today on our media page, which you can access at www.whatcomcounty.us/COVID. And with that, I will turn it over to Dr. K.
Thank you, Melissa. Can you guys hear me okay? Perfect.
I can hear you great, thanks.
My name is Sudhakar Karlapudi. Thank you for being with us today. I'm going to take a few minutes to give you a quick update about COVID, our current state in the hospital, emergency department, and then talk to you a little bit about Omicron and what we can do to keep ourselves safe. But before that, I do want to say something that is sometimes not said often. Healthcare and healthcare workers have been in this pandemic for more than 24 months right now. And for every single day of those 24 months and every single hour, healthcare workers have shown up and taken care of people. And every day as the CMO for St. Joe's, I get to witness extraordinary acts of compassion, care, and kindness. And I wanted to say a huge thanks to everybody in healthcare for what they're doing. Sometimes it's easy to lose the gratitude for caregivers with all that's going on. With that said, I want a quick update on what's happening with COVID at St. Joe's and our EDs. During the height of the Delta wave, we cared for about 42 patients on one single day. That was the highest in Delta. As of Sunday, we cared for 61 inpatients with COVID. And then today we have 54 COVID positive individuals who we are providing exception care for within our four walls. I have said this in the past. From the very beginning, we have had elaborate plans that have been very creative in creating sections within the hospital to cohort COVID positive patients in designated areas. And we have been implementing our plans one after the other. At this point, we have multiple areas within the hospital that are dedicated COVID spaces. We are expanding to other areas within the hospital to create additional capacity. One strategy for creating this additional capacity is to significantly limit the number of procedures we do in the hospital. For a very long time, we have had a multiple group of physician specialists who look at cases and understand the impact of doing or not doing a certain procedure. And at this point, we are doing a few cases every day when there is clear harm if we were to delay any care. So we are doing very few scheduled procedures. We are fully open for all emergencies. We are able to support all kinds of emergencies that we routinely support through our EDs. So we are in an extremely busy situation, but we are fully open and operational, and we are able to provide high quality care. What we know from modeling, or at least predicted modeling, is that case counts are likely going to peak sometime end of January or middle February. I've seen those ranges. And I know that hospital cases lag that by about 2 weeks. So we are preparing for a surge with that timeline in our horizon. We are also watching the state of COVID capacity across the state of Washington. We are in constant communication with other hospitals to understand their challenges and how they are overcoming those. So we are staying updated with what's happening in order to be ready when the next surge in this surge comes. We what we wanted to talk, I just want a quick update on staffing. Every hospital in the US has had staffing challenges, and St. Joe's has had its share. Having said that, I feel very grateful that even though we have had staffing challenges, we have been able to be fully operational and cover our staff, thanks to the help of our caregivers, again, who have signed up for extra shifts, travelers who have come and stepped in, and many other interventions we have done to optimize our staffing. Moving to our ED, similar to the hospital, the ED has seen an extraordinary increase in number of cases, both respiratory illness and other illnesses, including traumas, STEMIs, strokes, and heart attacks. I just will have a plea to the community that the St. Joe's ED wants to support all urgent care needs, but please do not use our ED for the sole purposes of getting a COVID test or for any mild illnesses, because of the current volumes we are seeing in our ED. So that's the update I wanted to give you on current capacity and ED utilization. Another thing I wanted to share with you, and this is the last one, is Omicron and the differences between Omicron and Delta. It is true that Omicron in a large number of people is causing asymptomatic disease or mild disease. But our experience in Whatcom County is that with Omicron, if you get sick and required to be hospitalized, then you are as sick as you were with Delta. So they are extraordinarily sick, and they're requiring high flow oxygen similar to Delta. The only difference is we are not a lot less ICU admissions and ventilators, but there are people getting intubated with Omicron right now. So it is causing severe disease in those who are vulnerable to it, and but fewer ICU level care. Omicron still has the risk of long COVID, so it's important to make sure we get our boosters. If you haven't gotten your vaccine, it's good to start the vaccine, because vaccines do protect, and especially if you get your boosters, vaccines are about 70% efficacious, and all that thing we have said from the beginning, hand washing, masking, social distancing, are still pretty effective against Omicron. Another thing I want to talk about is incidental COVID. We have patients who come with other medical problems, and we test them for COVID and they're COVID positive. Those patients, even though they don't have any symptoms, are extraordinarily infectious, so we care for them in the COVID unit. What we have seen is they could come in with no symptoms only to develop symptoms a few days later. So I think this concept of incidental COVID is transient. We still haven't understood it fully, which means that we really don't know the full impact of Omicron and how severe a disease it can cause, even when you don't have initial symptoms. So those were my updates on our capacity and our request on ED use, and currently what's happening with Omicron and safety measures within the hospital. With that, I will hand it over to you, Erika.
Thanks so much, Dr. Karlapudi. Melissa or Scarlett, could you screen share the presentation, please? I think it's helpful by way of some of the epi curves. And if you could advance to the next slide, please. This is our second presentation today with with a different health officer for this presentation. So I want to draw your attention, and you don't need to be an epidemiologist to see the impacts we've seen over the course of this pandemic. You can see the various surges starting in April, then in July of 2020, over the winter of 2020 to 2021, again in April of 2021, and late summer, early fall. This is the statewide epi curve. And as you can see, where we are right now is at a scale that's nothing like what we've seen in the past. It pales in comparison. And if you go to the next slide, I can show you the Whatcom epi curve. What we're concerned about for a number of reasons in Whatcom specifically is we did not see over this period of time in the late fall and winter, we did not see our case numbers returned to baseline. They remained elevated. And you'll see in the hospital data as well, which I'll show you in just a moment, that our hospitalizations didn't decline to the rate that we'd seen previously. And that's concerning to have just a higher baseline. Just in terms of numbers, and if you can go to the next slide, our Whatcom case counts. As you can see, there are certain points that follow these surges. There are certain points where you can see a more vertical line, and where we are now is really almost truly vertical in terms of the number of cases that we're seeing. And just for a bit of context, at different surges in the past, we've seen upwards of 100 cases a day, sometimes 120. We've had higher rates than that, but usually just for a day or two. And for the last nearly 2 weeks, we've seen case counts in the 300 and 400 range, up to 500 cases a day. And we know that given the availability of over-the-counter testing products that were not available in previous surges, and the challenge in getting those into our systems, we know that even those numbers at 300 and 400 and 500 are undercounts of what's really happening in our community. And if you can go to the next slide, we know that, and this is the hospitalization data by state, you can see again these curves following these surges in hospitalization capacity and need following the case rates. And if you go to Whatcom County, it's a little bit less smooth. Can you go to the next slide, please? It's a little bit less smooth because it's a smaller data set. But again, as I mentioned, our hospitalization rates did not come down like we've seen in the past when we were in between surges. And what we know, and we've shared with you in the past, is that we generally see a lag between these high case rates and hospitalizations by 2 to 3 weeks. So what we're seeing now with thousands of cases each week, over 1,000 cases each week, is a real concern for what hospital capacity will look like in the coming weeks. Excuse me. And that said, Dr. Karlapudi talked about all of the systems that the hospital has put in place, which are extraordinary and incredibly helpful for our community. Our systems are stretched throughout. Many of you know or have heard that testing is very challenging right now. If you think about 400 people testing positive, there are that and many more who have tested negative each day. And there's just an incredible demand for testing, given how prevalent this has become in our community. And we are working with our partners to try to increase capacity. But truly, when you saw that line that shows just incredible growth, we don't have exponential resources. It's both a staffing capacity and just hours in the day among our providers to be able to provide the level of testing that our community desires. We are looking forward to having more over-the-counter products available from the state and from other partners as well through federal programs, as well as the opportunity for people to order test kits themselves to have home delivered. But that is not here yet, and we recognize the incredible strain that is putting on our businesses and our schools, because we know that any illness without a test could be COVID and requires an individual to act as such and stay home from work or school or keep their kids out of school. And so the sooner we can ramp up testing additionally, the better for our community, but we're just not able to keep up with the demand at this point. Similarly, we have high demand for other ancillary services like our isolation and quarantine facility. That facility has been at capacity for almost a month now. And this afternoon, in just a couple of hours, we'll be opening a second isolation only site. at Civic Field in Bellingham that will allow us to add capacity for those who are not safely able to isolate or need to be discharged from the hospital but don't have a safe place to go. So we're trying to release the pressure valves where we can and provide that partnership for our healthcare community. So that should be helpful, but again, with the numbers that we're seeing, we're very concerned about where this is headed and the burden of disease that we will be seeing in the coming weeks. So I think I will stop there and turn it over to Dr. Harley to provide some additional information.
Sure, thanks, Erika. And I don't know if it was Melissa or Scarlett that had the slides, but you can continue on with slide 7, I think it is the next one. This is just further demonstrating what we've talked about, that hospitalizations are skyrocketing, or sorry, cases are skyrocketing across the US and of course also in Whatcom County. It is true, thankfully, that hospitalizations are not accelerating at the same rate as the cases are. And we get a lot of questions about this, about Omicron being less severe. And it does seem as if people with the Omicron variant compared to the Delta variant are about, from some UK data, about half as likely to be present to the ED for care or get hospitalized. However, given the orders of magnitude increase in cases that we're seeing, this still leads to a very large number of people needing hospital level of care. As Dr. Karlapudi mentioned, we do, most projections are that cases should peak in the next week or two, and hospitalizations follow in the week or two after that, and then any surge that we see in deaths would be subsequent to that. Go ahead and next slide. Again, as has already been stated, we are setting almost daily records for a number of hospitalizations in Whatcom County. In our one hospital in Whatcom County, there's the large volume of patients is causing severe strain on the hospital, as we have heard. And as I mentioned, the acuity on average may be lower, but there's still a large number of patients needing a significant amount of care. I think Dr. Karlapudi touched on most of that, so I'll carry on. Next slide. Obviously, other arenas in our community are being affected as well. Those of us that are parents know that our schools are also being stretched by this Omicron surge. I just admire schools so much and the school staff. They have all become almost like miniature health departments within their own facilities and just have made heroic efforts to really try and keep our kids in school. However, they are seeing an enormous increase in absenteeism from students and staff with this surge. In some cases, they had to move to remote education due to limitations of staff or just the amount of cases that they saw among students. And we expect this to continue in coming weeks. And I talked with school partners today, and some of them said they feel like, you know, they have been fighting this fight and really keeping transmission low within their schools and applying all the prevention measures that we have. And now they feel in some ways that that looks like a failure on some part, that they're seeing so many cases, but this is really expected for the level of contagiousness for the Omicron variant and how much community spread we're having. So I did try and reassure them on that front that their valiant efforts are still needed and making a big difference in their schools. As you probably are aware, the CDC updated guidance for isolation and quarantine for the general public late last month, and the Washington State Department of Health updated the guidelines for the K through 12 schools in accordance with the CDC guidance. This means that students in school will also move towards shorter quarantine and isolation periods with an emphasis on testing to keep them in school. One ask is that everyone is patient with the schools. in the districts throughout Whatcom County. They all have different levels of capacity and are implementing the new guidelines to the degree that they can, but in many places it's going to be a gradual or stepwise process as they move towards this large shift in guidance. So definitely patience with them as they try and implement what has been rather a dramatic change from the CDC and now from the DOH as well. Go ahead and next slide. And as we know, vaccinations are one super powerful tool that we have to protect ourselves not only against symptomatic infection, but most importantly from severe disease, hospitalization, and death. And the health department has really been working hard to identify areas in which we can expand our vaccination efforts. And we certainly don't do this alone. We coordinate with partners in many different sectors to try and increase access to vaccinations within our community. But what we've noticed now is there's a lot of constraints on people's ability to expend any efforts. As Dr. Karlapudi said, we've been at this for 2 years in healthcare and public health, and everybody is doing pretty much all they can. And so it has definitely been a challenge, mostly because of healthcare staffing. So there is a large menu of options for people seeking vaccinations, but each one has a limited capacity. So continue to, if you're out there and you need a vaccination, especially a booster dose, continue to try all these variety of options that are available to you. And just as a highlight, booster doses are now available for children between the ages of 12 and 15. In December, the CDC authorized boosters for 16 and 17-year-olds, and then just last week for children between the ages of 12 and 15. So that's a new change to make note of. Go ahead, next slide. And the reason we talk so much about vaccines is because we see their effectiveness. Vaccinated people of all ages are less likely to get COVID-19 infection, anywhere from 2 to 6 times less likely to get symptomatic infection, and definitely even more powerful of an effect is seen on hospitalization, on the prevention of hospitalization, where people are 10 to 13 times less likely to get hospitalized after being fully vaccinated. Go ahead, next slide. I want to commend our community as well. As overall 68% of our community that's eligible for vaccination has initiated vaccination. And it's we expect that number that's, I think that's the completed vaccination, and that number will increase as there's many more that have initiated vaccination as this surge has come upon us. And these are our current percentages. We see that the children ages 5 to 11 who were just authorized in November are up to a 30% vaccination rate. However, we still have around 50,000 people in Whatcom County that are unvaccinated, and only about half of those who are eligible to receive a booster dose have received it. And we know that the Omicron variant has decreased the effectiveness of vaccines, not completely, but it has less of an effect on Omicron than it did on Delta. So that booster dose is especially essential to enhance your protection against hospitalization and death. So those people that are out there that are still needing to get their booster dose, we encourage you to do that as soon as possible. Next slide, I think, is just a summary. You know, all this to say we've had a dramatic rise in cases, I think hardly imaginable even like 2 months ago, and our highest hospitalization rates yet. We're seeing businesses and arenas throughout the community affected by their workers being sick, and certainly a high impact on our schools. Thankfully, we do have tools that we didn't have this time last year. We have vaccines that we know prevent severe illness and hospitalization in most people. We have this increased capacity to care for those who are in their infectious period and unable to acquire housing with the isolation and quarantine facility. We have a healthcare system that is really facile with taking care of people who have COVID, and schools, like I said, that have implemented so many tools to keep students safe. So there is a lot to be proud of ourselves for and a lot of hope yet, but this is a challenging time, and we want to encourage people to hold on through this next bit. That's all with the presentation, so you can probably.
Thank you to our presenters. At this time, we'll go ahead and open up our question and answer period. Again, we invite any members of the media who have a question for any of our presenters to go ahead and type your name and your affiliation into the chat, and we will call on folks in the order presented there to go ahead and unmute yourself to ask your question. And I don't yet see any questions in the chat. Alternatively, you can also raise your hand and we can call on folks that way as well.
I can talk for a second about a question that I get a lot, if that is helpful. Or in this.
Yeah, please go ahead. Thank you.
You know, a lot of people are asking about the oral antivirals or the monoclonal antibodies. And I just wanted to note that these are up and coming as additional tools for us. And I just want to say that the supply is really short right now, unfortunately. So we are getting small amounts of these tools to prevent severe infection in our community, but there's a national shortage of both the monoclonal antibody that's effective against Omicron and the oral antivirals. They're just still being produced. So partners in our community are asking for them and they are being distributed here, but the rollout is small for the time being, unfortunately. But hopefully more to come.
Thanks, Dr. Harley. It looks like our first question is from Jeff. Jeff, you can go ahead and unmute yourself to ask your question.
Yeah, this is Jeff Pogela with Como Radio. You mentioned that you're kind of standing up a new isolation and quarantine facility. Can you talk a little more about that?
Sure. This will be an overflow site. Essentially, it will be isolation only, so only people who have tested positive. And it will be at the, it'll be a congregate setting in the locker rooms of Civic Field, not where the stadium is, but directly adjacent to the Sportsplex building, where the Northwest Youth Services shelter was previously located and will be relocated to the Maritime Heritage Shelter. So this will have capacity for up to 25 individuals who are currently COVID positive, and will help release some of the pressure at our base camp site, as well as any folks who are at the hospital that need to be discharged safely somewhere else.
What's the current capacity without this new facility, and when do you expect it to be up and running?
The current capacity at our Byron Street Isolation and Quarantine Facility is 55 individuals, and we have been at capacity or nearly at capacity for the last month. So we recognize that this is needed as soon as possible, and it will be open in an hour and a half at 4 o'clock today.
Thank you.
Thanks, Erika. Our next question is from David Rosbach with the Bellingham Herald. David, go ahead and unmute.
Hi, Erika. Thank you for taking the time to speak to us today. Was interested, and you kind of touched on a little bit about the shortage in testing. It seems like our testing facilities are maxed out, as you've said, as a number of our systems are, with the increase in cases. How effective are we getting people that need to be tested, close exposures, symptomatic, getting those people tested in a timely manner? And what options have you looked at for trying to increase, or is it even possible to increase the testing capacity that we have now?
Thanks for the question. I'll start, and if Dr. Harley has anything else to add, I'd welcome your comments as well. We only know what is coming to us Our call volume to the health department is extremely high for people who are symptomatic or have an exposure and want to get tested. At this point, we are about 4 days out from sort of general purpose testing where people can register themselves, and we're able to get folks who are symptomatic or have a close exposure in earlier than that, but it still can be days. So we know that there is an incredible demand of what we're seeing. We also imagine that there are many people who aren't calling us who do need testing and are unable to find it at this point. And again, I just want to acknowledge the strain that's putting on our employers at this point, if people aren't able to determine decisively if they have COVID or not. We are again constrained by staffing, and that has been our biggest constraint. It's not the swabs, it's not the lab capacity, it's been staffing. And truly just the magnitude of the need is so far beyond anything we've ever seen before that to be able to ramp up effectively would take a bit of time. And Dr. Harley, I don't know if you have anything you want to add to that.
Yeah, a little bit about that. I mean, it's true that it's been a challenge to expand like our community testing site with the healthcare staffing shortages that we're facing. There is some movement on expansion of at-home testing. The Department of Health has an increasing amount of tests to distribute, which they will be distributing through the local health jurisdiction and also through the schools. So we expect an infusion of rapid antigen tests through the health department and through the schools in the next week to two. And additionally, there's as you are also probably aware, there's a direct-to-consumer portal that is being developed. So a website where people can go and request at-home tests to be sent directly to their homes from the state. So those are some upcoming options that we hope will alleviate some of the testing burden. I just also want to say that our healthcare partners are doing also all they can to enhance testing. I know that many of the clinics in our community, family practice clinics and the tribal partners are doing a lot of tests for their patients and for other community members. And I don't know if Dr. Karlapudi, you want to talk about the program for the efforts for employees or healthcare workers at the hospital.
Thanks, Amy. We are working right now on a process to streamline how we can test physicians, caregivers who work at St. Joe's, and that's a process that we are working through. I think details are being worked out through our incident command right now, but I acknowledge the need. The demand far outweighs the testing people, not the test itself or the kits, but the people who need to collect the samples and do the work.
If I can just add one more thing, we are working to develop some prioritization for those kits, because again, those will not be enough to be able to distribute to everyone in Whatcom County. We want to make sure that first and foremost, our congregate facilities, our homeless shelters, the sites where people are really vulnerable and at risk for contracting the virus are well taken care of with regard to testing capacity. We then want to make sure that we have tests available for childcare providers. Dr. Harley mentioned schools, of course, also our service industry, employers, where and processing plants, factories, et cetera, where people are required to report to a place and be in direct contact with others or with the public. So we're really trying to think about how to best utilize the scarce resources in a way that we can prevent infection as best as we can.
Thanks, everyone. Our next question is from Dave Willingham with Cascadia News Now. Dave's question is, with the huge spike in infection rates, is there any concern that we could be seeing a new variant appearing in our communities? And does PeaceHealth have the capacity to screen for that?
Good question. As long as a virus has access to a human host, there is a possibility for mutations to happen, and that is just a scientific fact. That's how viruses mutate. So the longer the spike goes, the more people get infected, the more probability of new variants developing across the world, not just Whatcom County. The genetic testing that is required to do genomic sequencing for viruses is usually in research laboratories, and University of Washington has one, I think. So typically, frontline hospitals do not do genetic testing. So PeaceHealth does not have that capacity, and we depend on research labs, state labs to tell us the genomic sequencing for viruses.
Thanks, Dr. Karlapudi. Dr. Harley, did you want to add anything to that?
Oh, I was just going to say that, you know, even though from the genomic sequencing data, you know, it says that we have, I think the latest count was 28 cases of Omicron in Whatcom County. We know that probably virtually all of the cases in Whatcom County are likely to be Omicron right now. And there's an early marker that is visible on the PCR signal that it, is consistent with Omicron, and that's close to 90% in our county. So even though we don't have the genotype, that chances are that we're close to that number of Omicron cases in Whatcom County. And there, I have not heard any reports of a new variant, at least widely circulating.
Hey, thank you to all of our speakers, and thanks everyone for joining us today. This concludes our briefing. And again, as a reminder, we will get this recording up and posted at whatcomcounty.us/COVID by the end of today. Thank you and enjoy the rest of your day.
Thank you all.